Guys, I'm Dr. Eric. Today I'm going to take you through a obstetric tool used in monitoring of labor, partograph. Partograph is a tool used to monitor maternal and fetal well-being during active phase of labor. Active phase of labor starts from 4 centimeters to 10 centimeters. So if you use this partograph, there is a decision making when you have seen an abnormalities. Maybe the line has passed the action line. So fetal indication for when you are using this, we check on fetal heart rate and also amniotic fluid, the quantity of that fluid, also the color and the smell of that color. We are another indicator, descent, this head descent. When the head drops down to the pelvic region, we can indicate through a partograph. Maternal indicators, we check on the vital signs, temperature, blood pressure, also heart rates. We can use this indicator, and also rupture of membrane. People say that margin may break, but this one can also help. Uterine contraction, we can also, that one is also indicator. Urine output, when passing of urine, you can monitor through a partograph. Drug administration, any drug used in a mother during labor, you must put in a partograph. So action line starts 4 hours immediately after latent phase. So you count 4 hours, you start from there. And these parthographs helps us to take decision making like augmentation of labor, rupturing of membrane, and also you can take an action like cesarean section. Let's start on our partograph. A partograph has a biodata. Biodata has name. Gravida is a number of pregnancy. Parity is the number of live pregnancy with maybe a miscarriages. And also date of admission, time of admission, rupture of membrane, we can see there. On fetal heart rates, it is taken after every 30 minutes. So after every 30 minutes, it should be plotted against this graph, and it is plotted by an X. And then we go to the next one is amniotic fluids and the molding of the head. So it is indicated. We can use also an X with the molding 0. And going on to the third section is cervix. Cervix, which is plotted with an X. It is the dilatation of the cervix. So if a patient comes with the 6, you plot on the 6. 6 is somewhere here. If you can see, we can plot it. 6 is there. And dilatation of the head. It's when the head moves to the pelvic gauge. So it's plotted with a 0. So you can plot there with a 0. And also contraction of the uterus. So from a mild contraction with less than 20 minutes. So after 20 minutes. And then we go to the moderate, it is 20 to 40. So under severe, more than 40 minutes. Any drug used like oxytocin is given a space for oxytocin. You can indicate the drugs used at what time. Time is indicated to this region. So at what time did you start your oxytocin? So you can use there. Any drug given to this patient, maybe antibiotics, IV fluids, you indicate at what time did you give those drugs and also fluids. On BPs, you indicate the systolic and diastolic, and also temperature is also indication. And maybe to the between, you indicate the pulse rate, and temperature you indicate at the next region. Maybe a patient has a higher temperature because of infection, it will be indicated. Urine, it is to maybe to see proteinuria, ketones. You can indicate to this space. Proteinuria indicates preeclampsia or eclampsia. Ketonuria indicates of maybe the patient is not, maybe the patient has not fed for long. And outcome for the after delivery, you indicate everything. So to our doctors, this partograph should be indicated, and it should be put in the patient's file for any verification of these patients. So outcomes, the duration of labor, the outcome, the weight of the patient, the loss of the blood and vitals should be indicated. So if you are watching this video for the first time, just comment and hit the bell, and also you can subscribe to this channel. So we see you in our next section.